My name is Dr. Gasca from Black Diamond Periodontics. We want to make this video in order to introduce what should a patient expect in coming into a consultation with me. First of all, I want to take an opportunity to thank the general dentists and providers that I partner with. We built up a lot of trust through educational meetings, educational talks, different kinds of experiences through patient care together, and all of that to be said is to bring to you the best care we possibly can together. Our consultation is broken into 4 different components. Number 1 is an introduction, an examination, an open discussion, and then finally a summary of all points that we need to make sure we better understand. Let's jump right into it. An introduction. Introductions are so important for allowing us to get to know one another, and I spend the first 5-10 minutes of every appointment allowing just for that. I'm a big believer of the line that nobody cares to know how much you know until they know how much you care. I like to be able to utilize that to make sure that you can really see that our business revolves around your well-being as a patient, not the other way around. The examination. As a periodontal specialist, my entire goal is to make sure that there is no stone uncovered. Our business model is not a prescriptive care model, meaning that if somebody is referred for one thing, we're only going to look at that one thing. We're going to look at everything. Your provider and I really believe that if we have 2 sets of eyes on everything, we can collaborate much better and really get a better understanding of what you need as a patient and where your overall situation is to make decisions. After the examination, I'll sit patients up and then sometimes provide them a mirror just to be able to see what it is that I want them to focus on, whether or not it's recession or some redness in the gums. All these things are nice to connect with the patient to know this is what's actually happening in your mouth. At that stage, we then use that information to figure out how is that going to shape your health long-term, short-term. What are the options for how to take care of something if it's something is in need of treatment? In addition, this is an opportunity for us to answer all your questions, to make sure everything does make sense from what we're describing. If we can't reason through what we're describing together and also about what we're going to do, we probably shouldn't move forward with anything in the first place. But this is our opportunity to get all the cards on the table. The summary. In our quest for no surprises, our goal is to give you all the information you need to make a great decision. Part of that, we're going to recommend a procedure or recommend a course of treatment. Our goal is to give you ahead of time, what is that going to look like from a healing perspective? What to be prepared for prior to coming in for your procedure? And of course, what are the costs of the procedure? That's a huge concern that most patients share, and we want to make sure to throw all that on the table so you can see everything holistically before making a decision about moving forward. Lastly, I'll always discuss a little bit about the urgency. Is there an urgency? Should we schedule on our schedule as fast as we can? Should we wait a couple months? Do we have some time and flexibility? That's a very important point that we like to include in our summary. A quick side note. When I see a consultation on the schedule, what I truly think that means that your general dentist cares about you getting the right information to make a good decision about your oral health, and they're concerned about you. I also think it means, and it shows me directly, that your provider absolutely values comprehensive dentistry, and that periodontal treatment is sometimes the best foundation for healthy teeth. That's truly important to know. I look forward to meeting you for a consultation and walking you through everything I can to help get you as healthy as possible moving forward. Thank you.